The main basic step after AMC Part 1 is the AMC Clinical Examination. What are the things which you should keep in mind after passing the AMC 1 if you are preparing for AMC Clinical? You will be able to log into your candidate account on 20 July and your result very much depends upon the code of conduct. So the most important and the crucial thing which most of the doctors, most of the students do not know about is the expression of interest. Hello everyone and welcome to Academically, and today we are going to talk about the clinical examination. So which clinical examination are we going to talk about? We are going to talk about the Australian Medical Council Clinical Examination. We have been making videos, we have been talking about the AMC Part 1 examination, about the MCQ questions, about the exam pattern, about the timing and everything. But the main basic step after AMC Part 1 is the AMC Clinical Examination. And even here, the main step or the main challenge which the students have been facing and which they face is the exam booking. There's this continuous thing which keeps coming that, the slot booking, this, that, because at the end of the day, AMC Clinical is an examination which you have to go to Melbourne and attempt, right? So let's talk about, so we will be talking about in today's video all about AMC Clinical Examination. What are the things which you should keep in mind after passing the AMC 1 if you're preparing for AMC Clinical? And the most important thing is you have to get there. You have to book the slot, get the slot, and expression of interest and rest of the things in today's video. Let's stay started. Alright, so the first important thing which comes up over here is the eligibility. You all know that you have to pass the AMC Part 1, that is the AMC CAT MCQ examination to be eligible to apply and attempt the AMC Clinical Examination, right? Again, you all know about the exam clinical structure, clinical examination structure as well, right guys? Let's just revise quickly. So there are total 16 assessed stations. You will be given total 20 stations, out of which 4 will be unscored and 16 will be scored. Please note, you will not know which are the scored stations and which are the unscored stations. So you have to remember one thing, that out of 20, 16 assessed stations are the scored stations. And in each station, you will be getting 10 minutes everybody. So in each session, you will be getting 10 minutes, out of which 2 minutes is the reading time and 8 minutes will be your assessment time, right? So what are these stations? Stations may use simulated patients. They may be actors who may act as being patient. You may be using videotape patient presentations or charts or digital images. So it's like a demo, a mock of the actual patient-doctor interaction which is going to be conducted or which you are going to do in your day-to-day life in Australia once you become a registered general practitioner over there. And the things are given in detail. So as a doctor, you have to concentrate on history taking, examination, diagnostic formulation, management, counseling and education. Now, very, very important, Australia keeps on targeting their cultural heritage a lot. You need to know about the indigenous health pattern if you're going to establish yourself as a general practitioner in Australia, be it in the urban estate or in the rural side, or in the countryside, right? So that is very important. As GP, you should know about it. Now, how do you prepare for the clinical examination? You have to familiarize yourself with the clinical examination specification, right? And there are many other bridging courses also there. We Academically also provide you with the clinical preparatory course for AMC. We have mock interviews, we have mock demo sessions. Just like the examination, we prepare a scorecard and we give it to you so that you have an idea that, okay, this is the way I have to react when I have my condition or when I have my patient or where I have my mentor or my Viva, assessment practitioner over there, right? So these are the candidate briefings videos you can see on the AMC website. Now, the most important thing which comes up over here is the booking and conduct of candidates. See, very, very important this line, because it is expected that during the examination, you have to comply with the AMC Clinical Exam specification, and your communication and your manner, your body language has to be very proper, because that is what shows how you're going to represent yourself in a hospital setup or in any Australian healthcare setup when you actually work as a general practitioner over there. right? And your result very much depends upon the code of conduct as well. You should conduct yourself as a professional general practitioner and talk to the patients with sympathy and on a very soft tone. Even if the patient is very agitated, they'll actually see the kind of expressions you make, the kind of maturity you have in handling a situation. These things also are assessed along with your knowledge. Now, the very important thing and the very, crucial thing which comes up over here is online examination scheduling. People are often confused about what kind of schedule do you get, when will I able to attempt my AMC clinical exam, because for a fact we know that AMC MCQ CAT examination is conducted every month throughout the year except December and January. So people have this idea that okay, if not this month, probably I'll reschedule for the next month and I can sit for the next month. That's fine. But does that also take place in AMC Clinical? Let's see. So the AMC will continue implementing priority scheduling. It's a priority scheduling, first come, first served basis. You do not have to wait for the last day to schedule your examination. You have to schedule your examination as early as possible, because across the globe people are sitting to book their examination and they have this priority scheduling thing that they actually mentioned right over here. And booking an online exam is very important. Alright, the first thing you have to do is you have to submit your application to AMC that I am a person, I am a doctor, and overseas or IMGs especially for you, I am an international medical graduate, have finished your AMC CAT MCQ part 1 examination and I am looking for a slot for part 2 clinical examination. This is the application you give. So you have to submit an email application to AMC to clinical@amc.org.au. Alright, and what should the online application include? Your subject, candidate ID, full name, email address, examination date has to be mentioned, employment location. What is this MM3, MM7? Monash model. MM is Monash model. What do you mean by Monash model? So basically guys, the territories in Australia for the healthcare practitioners have been divided into 7 categories. MM1 comes under the tier 1 categories and you move on to MM7 and you move on to the rural areas. So it's divided like that. So you have to mention that. Your proof of current AFRA registration status and your proof of residence if you have any. Right? So these are the things which you have to keep in mind while submitting the application. Right? And after that, if there is anything, if there is any revert, the people will give you a revert and you have to act accordingly. So for the September to December, as you all know, we have already talked about this, the dates have been released. So how the release will work? Number one, the candidates which have limited registration. This is a step 1 for you. If you have qualified AMC CAT MCQ or working in Australia with a limited registration, you have your MC staff will contact you somewhere around. So they have all these dates have already been done. So they will contact you. The candidates with limited registration have to apply for a face-to-face clinical examination. Alright, this is for these candidates. But if I talk about the normal IMGs, for all the candidates, you will be able to log into your candidate account on 20 July, right? On 20 July 2026, please remember everybody, the dates for the people who are working in Australia under limited registration has been completed. But for you all, the dates were released yesterday, that is 20 July on Monday from 10 AM to IS to identify their preferred exam dates. And that is where you have to click. Okay, so if you're still waiting, 1 day has gone by, don't worry, the exams will be allocated on a first come, first allocated basis, regardless of registration status or geographic location at the time you submit your preferences. So you have to apply from your own country in an online application. These are open for you. It has just opened yesterday. Please go and apply for the AMC clinical exam if you are waiting for the September to December candidature, right? Then the AMC will contact all the eligible candidates to come up. Now, what is expression of interest and waiting list? So the most important and the crucial thing which most of the doctors, most of the students do not know about is the expression of interest. And what is this expression of interest? It is the waiting list. As I mentioned, if one of the candidate is rescheduling their examination and you are there, right there, that I am waiting for one slot to come and I'm going to go and give the examination there, you automatically get upgraded and your waiting list gets confirmed as a proper slot. So candidates who are unsuccessful in securing a clinical placement, you may be added to the expression of interest wait list based on the timestamp of your first preference submission. That is why you have to submit as soon as possible. So the dates have been released. Please go check that out. Even if you don't get a slot, you will be there on the waiting list. If your priority is high, you will get the slot. Those added to the waiting list, you will be notified. So what are the following conditions which will apply? Inclusion on the expression of interest wait list is limited and subject to operational capacity. So that is why go and apply now. Candidates may receive an offer for examination placement at any time. The moment anyone reschedules, you will get the offer for examination placement from several months to few weeks prior to the scheduled examination date. Guys, AMC does not provide specific time frame or guarantees regarding the timing or likelihood, but yes, you are there in the queue. And inclusion on the EOI waitlist does not guarantee allocation, but expression of interest submitted via email will not be accepted. So do not send an email to them that, okay, I am waiting for the expression of interest waitlist, please consider me. No, you have to pay the fees, you have to apply, and automatically you will get an email that you are under expression of interest right now. You may get upgraded, but you are in the queue. So then after that, you have to make the payment for it, and then your pass requirement. You all know over the 14 stations pass, you have to obtain a pass score of 9 or more of the 14 SS station. That is very much important, and you can log into the AMC website and see your result. Now, they've also mentioned how do you reschedule your examination. To withdraw, if you have to reschedule, refund will be provided only in exceptional circumstances. Your dates can be changed if you're wanting to reschedule, right? Now, this is very, very important, guys. As we mentioned, let's just sum up what are the examination scheduling things, all right? So, you know, stage 1. Remember everyone, if you have a limited registration, very much like almost 1 month before, you will be getting the option to go for the clinical examination for a face-to-face thing. But for all the students out there who are international medical graduates applying from their own country, you will be getting a date, and that's a first come serve priority scheduling basis. The moment you get the date, remember, if you are from different time zone, you have to manage the Australian time. You have to keep the Australian time zone in mind, and as soon as the portal opens on that very day, right, you have to keep the date. Like this time it is 20 July, just opened today, right? So as soon as it opens, you have to go, you have to apply. Whether you get the slot or not, you will be there in the expression of interest or waiting list. You have to do the payment, and if you get a slot, you have to go and sit for the examination. You have to pass accordingly. And how will you view your result? You have to go to the AMC website, log in, and you will be able to see your result. Also, they send an email. One more thing, guys, just recently, I think 2-3 days before, we have got a latest AMC clinical exam result out here at Academically. You can go and watch his interview. You can see what important things you have to keep in mind when you're going for the AMC clinical exam. The video is available on our YouTube channel, and we will be happy. Academically supports and prepares you for AMC Part 1, for the English examination, for the documentation procedure, and AMC Clinical. So one place, all the preparation from documentation to AMC Clinical under one roof here at Academically. Please like, share and subscribe our video, and do let us know in the comments if you want to know anything about the AMC Clinical Examination. I hope your doubts are more clear now. Thank you.